Welcome to Daily Dose of Parenting, your trusted source for expert advice, practical tips, and evidence-based guidance on raising happy children. In today's episode, we'll be diving into the 20 most common breastfeeding mistakes parents make and how to avoid them. Breastfeeding is a natural and beneficial way to nourish your baby, but it can also come with challenges. Understanding these common pitfalls and knowing how to avoid them can help make the experience smoother and more enjoyable for both you and your baby. Mistake number 1, not initiating breastfeeding soon enough. Initiating breastfeeding within the first hour after birth can help establish a good milk supply and improve breastfeeding success. Skin-to-skin contact immediately after birth encourages early breastfeeding and helps the baby latch on more effectively. If breastfeeding is not initiated early, it can lead to difficulties in latching and establishing a milk supply. Ensure that you aim to breastfeed your baby within the first hour after birth and keep your baby close with skin-to-skin contact as much as possible. Mistake number 2, improper latch. An improper latch can cause nipple pain and ineffective milk transfer, leading to frustration for both mother and baby. To achieve a proper latch, your baby's mouth should cover both the nipple and a large portion of the areola. A shallow latch can cause sore nipples and reduce milk intake for the baby. Ensure that your baby's mouth is wide open before latching and that their lips are flanged outward. If you experience persistent pain, seek help from a lactation consultant who can provide personalized assistance and help correct the latch. Mistake number 3, infrequent feedings. Feeding too infrequently can lead to low milk supply and insufficient weight gain for your baby. Newborns need to feed frequently to stimulate milk production and meet their nutritional needs. Breastfeed on demand, aiming for at least 8-12 feedings in a 24-hour period during the first few weeks. Watch for hunger cues such as rooting, sucking on hands, and fussiness, and respond promptly by offering the breast. Remember that frequent feedings are normal and necessary for establishing a good milk supply. Mistake number 4, not offering both breasts. Only offering one breast per feeding can lead to uneven milk production and potential engorgement in the unused breast. Alternating breasts during each feeding ensures balanced milk production and helps empty both breasts effectively. Start each feeding with a different breast to maintain even stimulation and milk production. If your baby seems satisfied after one breast, offer the other breast at the next feeding. Mistake number 5, ignoring feeding cues. Ignoring early feeding cues can result in a fussy and frustrated baby, making breastfeeding more difficult. Early feeding cues include rooting, lip smacking, and sucking on hands. By responding to these cues promptly, you can help your baby feed calmly and effectively. Avoid waiting until your baby is crying, as this can make it harder for them to latch. Keeping your baby close and observing their behavior will help you recognize and respond to their needs more quickly. Mistake number 6, supplementing with formula too early. Introducing formula too early can interfere with establishing a good milk supply and may lead to nipple confusion. Exclusive breastfeeding for the first 6 months is recommended unless medically necessary. Breastfeeding frequently and avoiding formula supplementation in the early weeks helps establish a robust milk supply. If supplementation is needed, consult with a healthcare provider and consider using a supplemental nursing system to keep your baby at the breast. Mistake number 7, not staying hydrated. Dehydration can affect milk production and your overall health. It's essential to drink plenty of water throughout the day, aiming for at least 8-10 glasses. Keep a water bottle handy and drink a glass of water every time you breastfeed. Staying hydrated helps maintain your milk supply and supports your body's needs during breastfeeding. Remember, if you feel thirsty, you are already slightly dehydrated. Mistake number 8, not eating enough. Inadequate calorie intake can impact milk supply and energy levels. Ensure you are consuming a balanced diet with sufficient calories, including protein, fruits, vegetables, and whole grains. Eating small, frequent meals and snacks can help maintain your energy levels throughout the day. Consider consulting a nutritionist to ensure your diet meets the nutritional demands of breastfeeding. A well-nourished mother is more likely to have a healthy milk supply. Mistake number 9, poor breastfeeding position. Incorrect positioning can cause discomfort and affect milk transfer. Using supportive pillows and experimenting with different breastfeeding positions can help find what works best for you and your baby. Common positions include the cradle hold, football hold, and side-lying position. Ensure that your baby's head, neck, and back are aligned and that you are comfortable. Adjust your position as needed to avoid strain and promote effective feeding. Mistake number 10, ignoring pain. Persistent pain during breastfeeding is not normal and can indicate issues like mastitis or thrush. Addressing pain promptly is crucial to prevent complications. If you experience ongoing pain, seek help from a lactation consultant or healthcare provider. They can assess your breastfeeding technique, check for infections, and provide appropriate treatment. Don't ignore pain or assume it will go away on its own. Early intervention can make a significant difference. Mistake number 11, not burping the baby. Not burping your baby after feeding can cause discomfort and gas. Gently burping your baby after each feeding helps release any trapped air. Try different burping positions, such as over your shoulder, sitting on your lap, or lying face down on your lap. Be patient, as some babies may take longer to burp. If your baby seems uncomfortable or fussy after feeding, additional burping may be needed. Mistake number 12, weaning too early. Weaning before 12 months can deprive your baby of the nutritional benefits of breast milk. Aim to breastfeed for at least the first year, and introduce solid foods around 6 months while continuing to breastfeed. Gradual weaning allows your baby to adjust to new foods and ensures they continue to receive essential nutrients. Consult with your healthcare provider for personalized weaning advice based on your baby's needs. Mistake number 13, not taking care of your nipples. Neglecting nipple care can lead to soreness and cracking. Using lanolin cream and allowing your nipples to air dry after feedings can help prevent and treat soreness. Avoid using harsh soaps or alcohol-based products on your nipples, as they can cause dryness and irritation. Wearing breathable cotton nursing pads can also help keep your nipples dry and reduce the risk of infection. Mistake number 14, feeding on a strict schedule. Rigid feeding schedules can lead to underfeeding or overfeeding. Breastfeed on demand, allowing your baby to set the feeding schedule. Babies' needs can vary from day to day, and responsive feeding helps meet their nutritional and emotional needs. Trust your instincts and your baby's cues, rather than sticking to a strict timetable. Remember, flexibility is key to successful breastfeeding. Mistake number 15, not getting enough rest. Lack of sleep can affect milk supply and overall well-being. Rest whenever possible, and don't hesitate to ask for help from family and friends. Create a comfortable and quiet environment for breastfeeding and napping. Having your baby sleep in the same room can make nighttime feedings easier, and it is highly advisable in the first year. Prioritize self-care and accept support to manage fatigue. Mistake number 16, using pacifiers too early. Early use of pacifiers can interfere with breastfeeding and lead to nipple confusion. Wait until breastfeeding is well established, usually around 3-4 weeks, before introducing a pacifier. When your baby shows signs of needing comfort, offer the breast first. Pacifiers can be helpful, but they should not replace feedings. Use them sparingly and ensure they are clean and safe. Mistake number 17, ignoring growth spurts. During growth spurts, babies may want to feed more frequently, which is a normal part of development. Increase breastfeeding frequency during growth spurts to meet your baby's increased nutritional needs. Growth spurts typically occur around 2-3 weeks, 6 weeks, 3 months, and 6 months. Be patient and responsive, understanding that these periods of increased feeding are temporary and support your baby's growth. Mistake number 18, not seeking support. Breastfeeding can be challenging, and lack of support can make it more difficult. Join a breastfeeding support group or seek advice from a lactation consultant. Connecting with other breastfeeding mothers can provide encouragement and practical tips. Don't hesitate to reach out for professional help if you encounter problems. Having a support system can make a significant difference in your breastfeeding journey. Mistake number 19, Returning to work without a plan. Returning to work without a breastfeeding plan can disrupt milk supply. Plan ahead for pumping at work and discuss your needs with your employer. Invest in a good quality breast pump and learn how to use it effectively. Schedule regular pumping sessions to maintain your milk supply. Store expressed milk properly and label it with dates to ensure freshness. Consider joining a workplace support group for breastfeeding mothers. Mistake number 20. Not ensuring feeding or food safety. High levels of stress can negatively impact milk supply and your overall well-being. It's important to find ways to manage stress effectively. Practice relaxation techniques such as deep breathing, meditation, or gentle exercise. Ensure you have a support system in place to help with household tasks and childcare, giving you time to rest and rejuvenate. Prioritize self-care and don't hesitate to seek professional help if you're feeling overwhelmed. Thank you for joining us on this episode of Daily Dose of Parenting. We hope these insights into the 20 most common breastfeeding mistakes have been helpful in guiding you through your breastfeeding journey. If you found this video valuable, please consider subscribing to our channel for more expert parenting tips and advice. Don't forget to hit the like button, share this video with other parents who might benefit, and click the notification bell so you never miss an update. Together, let's make parenting a more informed and enjoyable journey. See you in the next episode.